Welcome to another Brush Up with Bob. This week we have a special guest star, Eddie. Eddie's with us today. Notice how he's wearing a wonderful Hawaiian shirt. Yes, thanks for joining us today, guys. And today we're going to be talking about an interesting topic that's near and dear to my heart. And that topic is, why are we attracting adrenaline junkies into the EMS profession and teaching them how to be caregivers when we really should be attracting into this profession caregivers and teaching them how to deal with adrenaline junkies? What do you think, Josh?
Well, I think just the nature of the work we do naturally attracts the adrenaline junkie. I mean, you get to drive very quickly. You're acting in a lot of potentially compromising situations, so it's fairly natural for the adrenaline junkie just to come to the work.
Okay.
There's somewhat unavoidable attraction there.
So, do you think that the people that we're attracting into this profession, do you think we should maybe advertise other professions that they're not dealing with people in a one-on-one basis? You know, kind of like a, providing care for patients, customer satisfaction, having to do interpersonal communications, maybe a job that is not a communication type interpersonal job?
I think there's definitely a lack in some of those jobs that you could get, but at the same time, I think there's also the need in EMS, because I think there's certain skills the adrenaline junkie can bring to EMS. That,
Really?
well, for example, like the ability to think quickly on your feet. That's something I usually kind of associate with the adrenaline junkie.
So you don't think that somebody who is compassionate and caring about other people, you don't think that they can think quickly on their feet?
Oh, I'm sure that they can, but there's there's just other things that they also, I think, bring to the job as well.
Okay. What other things do you think they bring to the job besides thinking quickly on their feet?
Well, I think they bring passion.
Passion.
Yes,
Okay.
passion, and we usually, as the platform you're kind of bringing, as I understand it, is that we need to care for the people first. That's our main priority, which is definitely a part of the job. But as the adrenaline junkie, I think in teaching them to care for the person, as I said, not only the thinking fast on the feet, but they can also just bring what's the word I want? But anyway, they can stop making fun of me.
Oh, I'm not making fun of you. You're doing great. You're doing great, Josh.
But with the other jobs that I see is, as you said, they're all working essentially with machines.
Sure.
And so, but with the adrenaline junkie coming to EMS, they also bring the EMS is naturally just an exciting job, like I said.
Sure.
There's a lot of speed to it. There's a lot of thinking quickly on the feet, and there's also just the fact that you have to take care of people. So I think there's kind of a mixture of both, for sure. But I think you're going to get the adrenaline junkie regardless.
We're still going to get them regardless.
Yes.
So even if it's not for the money, because like jobs like dealing with commercial divers, we know they make a lot of money.
They do make a lot of money.
Logging equipment operators, boiler makers, wind turbine service techs, like up close to us, we've got wind turbines up there.
We do a lot of wind turbines.
So if it's not for the money, why are people becoming EMTs?
I think there's a variety of reasons. I think one thing is EMT is a little bit simpler to get than some of those other certifications. I mean, diving, that requires usually being close to water, getting some of your own equipment, quite a bit of work there as well. Wind turbine, not everyone likes heights.
Okay.
So
not everybody likes heights.
Also,
people who don't.
Some of those jobs you listed are fairly dangerous, which EMS obviously can be dangerous as well, but we don't tend to think of it as the high.
Okay, so it's a little less dangerous.
Right, they feel, I think, probably safer.
A little more safety?
Yeah.
Okay, so if EMS professionals crave that rush, what kind of calls, because we know we've got our 3 a.m. in the morning, my toe hurts calls.
Sure.
So if they've got the calls that are like that, what kind of calls do you think they really do like?
The adrenaline junkie.
The adrenaline junkie, yeah. The adrenaline junkie, what do they enjoy?
I would imagine they probably enjoy like the code blue. That's usually exciting. There's a lot to be done just in that one call. There's also a lot of physical activity that you're doing, which would probably appeal to the adrenaline junkie. Usually, I'd imagine a call where the patient's very unstable, like a cardiac patient, maybe cardioversion or pacing, something which you don't see as often, which also makes it more exciting as well.
Okay. So when they do lose that thrill in the adrenaline rush, I think that people are getting out of EMS and they drop it. You know, statistics are showing that EMTs only last about 5 years.
Right.
And, you know, other professions have people for 20, 30 years. Why are we losing people in this profession? You know, yeah, we still have the adrenaline rush of code blues. I mean, we're not getting any less code blues, possibly getting more. So why are people getting out of this profession after about 5 years, it seems like?
I would guess there's several reasons probably. There's may not be what they expected it to be, as you've already stated. You know, there's not as much adrenaline as you would expect. You know, there is a lot of those common, I stubbed my toe, I fell, I hurt myself, very common stuff that isn't as exciting, so to say. Pay, I imagine, is a large part of it. We are a very highly underpaid profession in general. It's
Sure.
in the probably low 10 percentile, I would imagine, as far as the pay goes. So yeah, the pay, like I said, is probably a big deal. I think a lot of things, there's subtle things, maybe time away from family and friends, just those long shifts can probably wear on people.
But don't you think that if we attracted the caregivers into the profession, those people who are about taking care of people, whether or not it's the 3 a.m. in the morning toe pain, or whether they fell down for the 5th time this week, if we attracted those caregivers and taught them to be adrenaline junkies, to enjoy the code blues, enjoy the traumatic injuries, you know, do you think that would be you think those people would last longer? Do you think they would make this profession a more highly respected profession, that we don't have that high turnover rate of losing people?
I think it could depend on the person. One thing I think some people would maybe resent of being taught adrenaline junkies. I think some of those people like the stability of their other job, perhaps like as an ER nurse, where it's a little bit more of a controlled environment.
Okay.
And I think that's one thing possibly the adrenaline junkie likes about the job, is that it's
So the vomit, the feces, that kind of stuff,
Right.
kind of.
Yeah, but the uncontrolled fact, the fact that, you know, you're in someone's house, you don't quite know what to expect.
Okay.
And that you're actually there in the environment, as opposed to maybe being more in the hospital clinical setting, the nursing home setting, just the quieter, more relaxed. And I think the adrenaline junkie enjoys that feeling possibly of control, where, you know, they are at the scene, kind of directing it.
I kind of get what you're saying. So that they're directing the scene, they have control,
Right.
but they still have that adrenaline rush. But what do they do when they lose that adrenaline rush? I mean, one, I'm guessing they probably get out of the profession.
I would probably agree with that.
That's
yes.
probably a big part. Do you think that possibly the more competent they become, the less exciting it's going to become on the calls?
There could be some truth to that. I mean, as you become more proficient at your job, you know, you're essentially a step ahead of the patient, and so you're hopefully predicting what would happen. And so instead of having that patient just plummet in the back of your ambulance, and then you're scrambling around, you know, trying to keep them from death's gates, as it were. But if you're a very competent person, then that could probably take away the adrenaline rush, because you have them stable the whole time. So I could see that.
So at that point, when they become competent, they're no longer worrying about the code blues. It's more of an orchestrated event.
Right.
They do this, then this, then this, and step 1, step 2, step 3, and it's no longer the unknown.
Right. As you become more experienced, there's not that degree of mystery and excitement that possibly I had before.
So, Josh, can you give me one instance? I know I could think of millions of instances in my mind, but give me one instance where there was a call possibly when you first started in EMS, and now those kind of calls are kind of a mundane call. And I'm not talking like the 3 a.m. in the morning toe pains, okay, because you thought that was mundane at the very beginning. But I'm talking, what kind of calls, you know, possibly that got you excited, dry mouth, all that stuff, the sympathetic response. What kind of call now is kind of a mundane call for you?
I think, especially when I first started, chest pain was definitely something that got me very excited. You know, started as EMT, you know, you knew that was something serious. You know, they could be having a heart attack. And then, you know, you put the patches on them. At that time, the only rhythm I really knew was normal sinus. So
Sure.
if you had anything that looked remotely unlike normal sinus, I mean, I thought you were going to die, kind of.
Well, you get into a treatment rhythm eventually,
yeah,
right?
sure. So, I mean, you know, that got me real excited and going. And then as I learned more, as I knew, you know, what we were going to do, what to look for, learning that even if it wasn't normal size, they could still be stable, and then I wouldn't say it necessarily became mundane, but it definitely did not raise the excitement level
Didn't
like
raise
it used to.
diabetic calls. Did that?
Yeah,
Those
yeah.
kind of go down a little bit.
Those probably went down a little bit, realizing just because they're unresponsive doesn't mean that, they have to go start doing CPR on them. And
So would you say that you have become more competent?
Yes.
You'd say you became more competent? So the more competent you became, the less exciting those calls were. However, do you not like providing patient care anymore?
No,
You still enjoy it?
I still enjoy providing patient care.
If you could change one thing in EMS towards the adrenaline side, patient care side, what would you change?
Repeat the question.
If you could change one thing in EMS
Okay.
that relates to patient care / the adrenaline junkie side, what would you change?
What would I change? I guess I would change, including, making it very clear to the people coming into the field what to expect, I guess. I think, when you start the class, you don't really have a very clear picture of what exactly you're getting into, and even if you're ride-alongs, depending on what you get, you don't really get that clear picture of just what you may have to do day to day.
So do you think that's a EMT instructor's fault?
Sure. I mean, I'm not necessarily blaming them, but yeah, just if they could maybe make a presentation just that's very clear what you're getting into. I mean, we often paint the good side, maybe painting a little bit of the bad, the negative side of the job as well.
Maybe a little less of the car wrecks, the trauma
Right,
calls, the
right.
code blues, and more of the, we're gonna run on somebody who's got abdominal pain and there's not gonna be anything you could do for them. And really, it's not that exciting, and you're gonna have to take them to the hospital or the interfacility transfer that you're gonna take at 3 a.m. in the morning for somebody who's got a gout.
Sure.
So maybe the instructors or educators need to work on explaining more what people are getting into in the EMS field, and giving that clear picture to the student. Hey, if this isn't for you, maybe go find be a commercial diver or,
Sure,
or be a
sure.
wind turbine service technician.
Yeah. Like I said, I feel like it's a combination of both. I mean, I don't think you need to completely eliminate the adrenaline junkie. I mean, there's still going to be that there, but make it clear that kind of what you were saying, you got to care for people too. You got to get that
Sure.
other foot to fall.
Do you think once they get their EMT, do you think the service does them a disservice when they get on? I mean, how many times have you heard when you get on a service, or heard other people talk about when they get on a service? That's what you learned in class, but we really don't run those types of calls here, and kind of play it down to the fact that almost we're eating our own young, to the point that we're kind of cliquish. We don't want people in our family. Do you think that also has a role to play with the adrenaline junkies? We kind of start to create a group, a pack, and
Yeah.
we're not letting other people in.
Right.
Whereas maybe the caregivers, if we train caregivers, they're more open. I mean, the hippies, if we had the hippies, that maybe the hippies would be more apt to let people into the EMS profession and wouldn't eat our own young and throw them to the wolves. How many times have you heard about people going on calls and their partner stands back and is like, hey, it's your call, you're on your own, and we're kind of a culture of safety now, trying to take care of people and make sure that you don't fail and I don't fail.
Yeah.
Because if we both fail, who's at the end of that line of that fail? It's the patient, and the patient's going to ultimately suffer from us trying to teach one another by failing. And maybe we need to be a little less eating our young and throwing them to the wolves.
Well, running them into the ground.
Running them to the ground. That's another one.
Part of
And
it.
be more apt to bring them alongside, teach them the ways, show them how to take care of patients, but also explain to them kind of the bitter side. But we've kind of been a little bit bitter, Josh, with everything that we've talked about. What about the real reality of the profession. I mean, possibly, you know, we tell them in EMT class, you know, all the bad things that they're about to get themselves into, but maybe, you know, instead of doing the good light of, you know, you're going to go on the code blues and go on the car wrecks, maybe tell them, you know, how people are going to accept them into their homes, and you know, they get a piece of somebody that, you know, maybe not even their own family members know about them, or a piece of history. You know, I remember a 30-year-old lady that was born in the 30s that told me about how the dirty 30s were, and that's why she had lung problems, you know, and it really wasn't much I was doing for her, but I got to hear that piece of history from her. I got to take that little piece, you know, kind of that remembrance also from the patients, you know, that when we run on them, they're able to remember us. You know, they come down to you 2 years later and say, hey, I remember you took care of me, and you're like, I don't remember you, for you, John, no, no, they don't remember their name, but you know, what about that? You know, what about maybe giving them kind of a little glimpse of some of the good things that, you know, keep people in EMS, that desire for, you know, to be remembered by patients. You know, they may not remember what we do for them. They may not remember, you know, exactly what we did, or what the issue was when we were there. But do you think they're gonna remember how we made them feel?
I hope so.
You would hope so?
We have the rather unique opportunity of being with someone on their worst day.
Yeah.
That's one way of looking at it. So, you know, what you do is ultimately what they will remember.
Ultimately what they'll remember. Well, those are our thoughts, folks. You guys are Eddie here. Eddie are wonderful, and I'm Bob. And you guys just let us know your thoughts and comments. Be sure to comment on the end there. And thanks for joining us on another Hawaiian Friday with Bob. Have a great day.